All right. Yes, Lagos, 16 minutes gone past five. You are tuned in to Smooth Health here in Smooth 98.1. And like I said earlier on, it's going to be great conversations we're going to be having, especially where your health is concerned. Today, we're going to be talking about the common cold and flu. I know sometimes you usually just hear people say, I have a cold, I have a cold. Do you know if you have a cold or if you have a flu? How do you get to manage it? How do you also get to prevent it? And if it is a problem, how do you treat it? Thankfully, I went and helped Lagos get the right person who's going to be sharing insights today. And I have virtually joining me Dr. Adegboyega Alao. He is a consultant family physician at Iwosan Lagoon Hospitals. Good evening and good to have you with me.
Thank you. Good evening. Thank you.
My absolute pleasure having you with me. Lagos, as always, you know, to join in, you have questions, you have contributions, you've had experience with a cold and flu. Well, you want to know how you can deal with it. Whatever questions you have, what you can do is share them with us on WhatsApp 0911 999 0981 0981 That is the WhatsApp number you want to have saved so you can share your thoughts and questions. And talking about questions, let's start with the basics. And so, a lot of people confuse, let me know, some people confuse the common cold with the flu. What exactly is the real difference between the two?
Okay. All right. Thank you for the question. Um, so let me start by saying both are viral illnesses. In fact, they are
Right.
viral respiratory tract illnesses.
Right.
But the difference is that common cold uh, give milder symptoms than the flu symptoms.
Okay.
I don't know if you get that. Yeah.
Okay.
So and then another difference is that the flu is specifically caused by a type of virus, that's the influenza virus.
Oh,
But
okay.
there are some other viruses that you know can cause common cold. So those are the two major differences in terms of what causes them and in terms of severity.
Okay. Okay.
Yes.
That is well, that is understandable. One is a virus, one is anyway,
No,
severity.
both are
What a
viruses,
virus
both are
is.
viral infections. Yes.
Right. Okay. So
But the
at least
types
now
of there are different types of viruses.
one is
So
higher,
the
one is
virus,
milder.
no, it's the symptoms, not that one is higher. So the symptoms for flu are more severe than the common cold,
Okay. Now that
even though
is
they give similar symptoms. They give similar symptoms.
you see, that's the thing. That's why I had to ask this question because sometimes I'm also confused. I've once upon a time said I've had the flu, and I'm like, I'm not sure I have the flu because usually when someone says the flu, I want to be avoiding you. That's usually my notion. But if you have the common cold,
Yeah.
they're like, don't worry, just do this, do that, you'll be fine. You don't see people running away from that person, but it's I don't know. We'll get into all that though. But here's
Okay.
something, especially in Lagos, Nigeria. You hear people say they catch cold during, or at least they have the colds during rainy season, just like we have right now, or during the Hamatan season. Why is that?
Okay. Yeah. So that is true because these viruses they thrive more during the cold seasons, during the low temperature seasons,
Okay.
and uh, especially in the temperate regions, it's even more seasonal in the temperate regions. Um, you know, the virus thrive during those seasons better than the warmer seasons.
Okay.
That's why you have the spread of flu more in the
Mm.
winter and all that in the very cold uh, um, weather.
Seasons. Yeah.
Uh, yes, or seasons. Yes. So the for but for this part of the world, we've had sporadic cases, even out of season cases, even though it's
Okay.
more common between September and April. That's when you have a lot of that, a lot of flu or common cold.
Mm. Okay. And you know, I, I would like us to actually touch a bit on the symptoms to look out for. So, when someone says that they
Okay.
have a cold, what are the symptoms they're looking out for?
Okay, so when you start sneezing a lot, you start having a runny nose, stuffy nose, um, sore throat at times, even headaches, fever can also be a symptom. You know, especially in the upper respiratory tract, from the throat to the nose.
Okay.
Then the sinuses, you can have very it can be very uncomfortable,
Right.
to put it mildly.
Hmm. Trust
Mhm.
me. Now people are trying to figure out, okay, do I have this? I've seen someone coughing. Is that shit? Don't you worry.
Yeah, that's why it's
Okay.
called common cold. It's very
Ah,
common. People have it a
right.
lot, especially around the season. There's a lot of it going on around currently.
So I once heard a friend say that once corn is in season, just know that the cold comes. I don't know what that has to do with corn, but yeah, she says once she knows that corn is in season, she knows that people are going to either have a cold, have cough, and all that. Anyways,
Yes,
I don't know
yes.
how true that is, but that is good to know. All right, now let's get into something that's a little more in our territory. Hamilton season will obviously after the rain, we'll have a bit of the haze. That is Hamilton. How, especially seeing we're always on the move, what are simple things people can do to reduce the risk of either catching a cold or a flu? We're in the buses, we're in our offices, we're in school, children are in school, and you know them. They're always touching surfaces. They never stay in a place. Even when they tell them, stay in a place, don't go, don't put your hand in your nose, don't rub surfaces. They never listen. Even as adults, I've seen adults in public spaces where they know that you're supposed to sneeze or cough into your elbow. They're out there just spitting everything out, and you're like, oh my days, you're spreading something. So,
Yeah.
how
Okay,
do we
so
save
yeah,
ourselves from all that?
yeah. So you just have to take much care, especially when you're out there. You
Okay.
know, avoiding crowded places in
Mm,
particular, because these viruses are spread in hair droplets. You know, people, someone who is infected can just, maybe with one sneeze or one cough, can spread it out to many people. So it's
mm,
better to stay in well ventilated rooms or, areas, and avoid overcrowding or overcrowded places.
right.
Then wash your hands regularly. You never can know what surfaces you've touched, that has been touched by someone who had the flu or the common cold. So you have to, even when you shake people, you never can tell. So I'm not trying to scare you from shaking people now, but
Oh my
just remember,
goodness.
just remember to wash your hands, regularly, or if water is not readily available, hand
Use a hand
sanitizers
sanitizer.
are almost everywhere.
Right.
So, and then when you get to where you can use the water, then you can wash your hands. So,
Uh,
and if you are the one who has it, you
right.
should try as much as possible to protect other people. There are
Okay.
ways of, taken care of. You can even wear a nose mask. You can, when you want to sneeze or cough, you cough into your elbow. So those are the things that help to protect other people, or even avoid the workplace for, certain number of days, maybe the first 3 to 5
Okay.
days, so you don't infect your coworkers,
Ah, I, I'm
So
sure
that
that
helps.
some workers will be particularly excited to hear that. Oh, so I can use that as a sick leave, right?
Of
Oh
course,
my
yeah.
word.
You can work from home. You can have to work from home during that period. So um, that will help protect
All
other
right.
people.
Hmm. Well, at least now you know. Don't say I didn't give you any tips. So in case you find yourself in that space and you're like, okay, I'm not sure if I'm strong enough. Well, just go to the hospital or, see your physician, and then they should be able to figure out if you warrant being home. Don't skip work because I said so. Anyway, still talking about prevention or protection, right? Whilst so some people already swear by taking vitamin C. Or I've heard there's a colleague of mine who says, "Oh, you have to up your vitamin C." She's always talking about how she's buying so much fruit, and then she's mentioned there are certain fruits in season right now, so she's upping it. Some others say all you need to do is eat right. Others even say, "Oh, the best thing is get enough rest." Right. I'm sure that all this are part of it. But do foods, vitamins, or even lifestyle habits, like even proper sleep and exercise, make a difference when we're trying to protect ourselves from or prevent ourselves from having a common cold or flu?
Yeah, sure, sure. You know, use of vitamins, proper rest, adequate sleep, all these things improve your immunity, and
Right.
protect you from common cold or even flu. At least it helps your body to be able to fight these viruses before they weigh you down. Or
Okay.
even if you manage to contact to get it,
Mm-hmm.
the symptoms can be very mild, and you can be able to deal with it. So vitamins, regular exercise,
Mm-hmm.
proper rest, these things help improve your immunity against these viruses.
Mm. Okay.
Yeah,
So there's no, okay, you're overdoing it. It's just do everything in moderation, more or less.
of course, moderation is the key. You shouldn't overdo it.
and now, here's the one thing. Like I said, before we got on air and all that, I know we're talking a bit about the cold and all. For certain people, the first thing they do immediately they find out they have a cold or flu is go to the pharmacy and they're buying medication over the counter. Now,
Mm,
most people, at least some people, rush to buy antibiotics whenever they have a cold or a fever or anything of that sort. But you know what? We'll talk about that because I have a quick breather coming through. When we get back in, we'll talk about that. If we should be even using antibiotics to cure the common cold. Lagos, I want you to stay close to your radio because you need to get this insight. I've seen people do certain things, but are we doing it the right way? What should be the best way to take care of, or the best way to save ourselves from a cold? We'll talk about that after this quick breather. The Move Muscle stay tuned to Smooth 98.1. Drive. Just a quick breather and they'll be back in. The kitchen game, there are players and then Agba Ballers, MVP, Player of the Year, 10-0, no rival. Become an Agba Baller with a new improved Maggie chicken flavor, made with a flavorful formation of onions, celery, turmeric to bring out your top game in the kitchen. Elevate the taste of your everyday dishes with delicious rich chicken flavor. Oh yeah, let's go. New Maggi chicken flavor, my game changer.
Fly Emirates to 5 destinations in the Chinese mainland: Beijing, Shanghai, Guangzhou, Hangzhou, and Shenzhen. And discover new trade hubs. Relax in comfort on board with our world-class hospitality. Explore up to 6,500 channels of entertainment. And stay connected with free Wi-Fi. With daily flights from Lagos to the Chinese mainland via Dubai, you can enjoy convenient travel that fits around your business schedule. Fly Emirates. Fly better. This is Smooth Health on the Drive. This is Smooth Health on the Drive.
All right, Lagos, 32 minutes gone past 5. You're tuned into Smooth 98.1. Today on Smooth Health, we are talking about the care and management of cold and flu. This is the season usually where you would have your usual common cold. So it's best to figure out how to protect yourself, your family, your loved ones. And if you have a flu, what you need to do to be better protected. You have questions, you have contributions. Have you experienced the flu before? Or are you trying to prevent one? Are you trying to treat one? Whatever the case is, if you have anything you want to share, you can come through on WhatsApp. The number is 0911 999 0981. 0911 999 0981. I'd love to hear from you. And I have with me explaining and sharing insights Dr. Adegboyega Alao. He is a consultant family physician at Iwosan Lagoon Hospitals. So it's a pleasure having him share this insights. Before the quick breather, we're talking about the abuse sometimes of over-the-counter medication and especially antibiotics. I want to know if that is the best thing. Some people have catarrh, they have a fever. The next thing they're thinking is, I have a cold. It's almost as quick as they're having body symptoms, they're having aches and all that. The next thing they're saying, oh, I have malaria. And they're going to buy malaria medication. Similarly, I've seen where people are buying antibiotics over the counter just because they have a cold. Is that something they should be using for cold or for flu?
All right. So you've rightly called it what it is. It is abuse of medications.
Okay.
So antibiotics used for straightforward common cold or flu, it's not necessary.
Mm,
You know, common cold or flu, are, they are usually self-limiting, and the illness should subside within 7 to 10 days, sometimes 2 weeks. But you should be getting better usually after 5 days. That's
mm,
it usually runs its course like that. So all you need
right.
to do is just you do things that will help you cope with the symptoms or reduce the severity of the symptoms. When
Okay.
you have fever, just take antibiotics.
Okay.
I mean, to reduce or to take care of the fever, take care of the
Right.
runny nose. There are things to use to, keep your nose dry during this period, or,
Okay.
help with the cough, the dry cough,
Right. Right.
things like that. You don't need to use antibiotics. However, in some cases, when it gets complicated, there can be superimposed bacterial infection,
Ah,
especially when
okay.
you're not getting better and
Okay.
you know you're not really getting better, and the symptoms are becoming severe. So
Okay.
then you need to visit the hospital. Don't just go and buy antibiotics by yourself. Just see your
Right.
doctor, get the proper advice. You
Mm,
could even have to do some tests,
okay.
to confirm if there is now a superimposed bacterial infection that may
Okay.
warrant the use of antibiotics. But ordinarily, you don't need antibiotics to take care of common
Usual
cold.
goal.
Yeah.
That is good to know. Now, talking about remedies, let's talk about home remedies.
Okay.
Some people swear by ginger tea. I'm a sucker for honey, but like I was telling you before we started program, I just learned. I don't know how. Well, you're the doctor. You can give me more insights. Um, I'd have hot beverage and I would naturally just put in my honey. And I just learned that you're not supposed to put honey in hot beverage, but hey, that's beside it. Anyways, but for those who like home remedies, the first thing they're looking out for is making ginger teas, agbo. They're looking out for pepper soup, all those kind of things. And the whole idea is, there's another one. They have buckets, put in some. I'm trying to remember the exact word for it now. There's some crystals that they put in, like peppermint crystals, cover themselves up, all to sweat it out. Um,
Mhm.
really, are these home remedies helpful, or are they just myths that were put out there, or are some good, or some supposed not to be, done at all?
Okay, so people have, you know, described their experiences with the use of these home remedies,
Right.
that it helps them to deal with the flu or the common
Mm,
cold. It has helped them at least reduce the severity of the symptoms
okay.
in many ways. People have, said things about that. But the thing is, the virus itself, like I mentioned earlier, is self-limiting. The infection itself is self-limiting. So
Mm,
um, even if you don't do anything, especially if you have the mild symptoms, they go
we
away
should be
by
fine.
themselves.
Right.
So you can, if that helps, yes, the ginger. So far, it's not something harmful to the body. The
Hmm.
ginger, the honey, what else? Okay, pepper soup and all that. You know, so
Right.
people use all these things to help them, cope with the symptoms at least till the time that the infection can subside.
Mm,
So yeah, but it has to be done in moderation, like we said earlier.
okay.
Overuse of these things too can now become harmful, especially the hagbo and all that.
Right. That one. There's usually no better vessel we can be drinking. Just downing things, you're mixing everything together.
Okay,
Well, I wouldn't say just do you, but if you're going to do you, be mindful and careful with how much it is you are ingesting, so you don't end up worse off than you were. And talking
exactly.
about you earlier stated that, so someone is having a cold or flu, uh, it's sometimes advisable to stay back away from work so they're not infecting others. Looking at the recovery pattern or time, if someone actually comes up with the flu, how long should they really rest before getting back to work? What's the in
Okay.
time, out time?
hmm Okay, so generally, it is recommended that um, you can return to work 5 days after the onset of symptoms,
Okay.
because you can spread it to other people within the first 3 days. Usually, that's
Okay.
when you can actually infect people within the first three
Mm,
days of the symptoms. But after like 5 days, the risk of spreading it to others has reduced, and the symptoms should be improving by then. You know, then sometimes if you are fever free for 24 hours, you can also return to work.
okay.
And or your symptoms have really improved. You think you
Mm,
can cope with work, yeah, you can return to work. But generally, 5 days. from onset of symptoms is recommended.
Okay. All right. So it's not that you now you get a note from the doctor and then decide that he has said I should stay away for 10 days. That's not what he said. Well, but even at that, when is it ideal to see a doctor? At what point should someone stop treating it at home and go see a doctor?
Yeah, so if the symptoms are getting really worse, especially the cough, the fever, if
Right.
you're having fatigue, you're having chest pain with the cough, this or even breathlessness sometimes, you
Oh.
should see your doctor at that time. You may be having pneumonia at that time because pneumonia can be a complication
Oh.
of flu or the common cold, you know.
Right. Right.
So so you should see, especially if the symptoms are not resolving or getting worse after 3 to 5 days, then you should see a doctor.
Mm. Okay. That is actually good to know because uh, you might just think that yeah, it's nothing, it's the usual cold, and then it gets worse. So please don't wait till things worsen before you go see your doctor. It's always important. And then let's get into this one. We don't talk enough about vaccines here. I don't know if it's because some people are afraid of taking vaccines. Well, they say some people have different notions where vaccines are concerned. So I'm not even going to get into that. But should we start thinking more seriously about getting um like in the abroad, you hear, oh, get your flu shots. It helps you, because once you have breakouts or outbreaks, rather, it helps to prevent you, keeps you in check. And how important really is vaccination where uh, outbreaks are concerned?
Okay, so flu vaccines are not really emphasized, you know, in this part of the world as it is in, um, the temperate regions that I mentioned earlier,
Right.
because theirs is more seasonal.
Yes.
We have sporadic cases here, even out of season flu in this part
Right.
of the world,
Right.
and it's an annual shot. The
Okay.
vaccine is an annual shot, so it in 6 months the uh, protection you get from the vaccination
Would have worn off.
decreases. Yeah, so and then new strains come up every year. I mean, new types of the same virus. The
Which
virus
reminds me of COVID
got a
actually,
lot of
because
mutation.
yes.
Exactly. So the same thing with flu. Every
Mm-hmm.
year, new strains come up because of
Right.
mutation. So they develop new vaccines every year for flu. So
Mm.
it's really not stressed so much in Nigeria, because and since it's usually common cold that we have here, you, you'll be fine in 3 to 5 days, and everybody gets back to work, we move on. So maybe that's why it's not so stressed. But if you can get it, if you are the type that travel a lot, to this part of the world, I mean to
Right.
those parts of the world, then you
Right.
might need to consider taking the flu vaccine
Regularly.
to get protected, especially if you're traveling in the winter
Within that
period at this
time
period.
period. Yeah.
Yeah, between September
Mm.
and April. Yeah,
It's really best to have that.
so that's it. Mm.
Hmm. All right. Thank you so much for breaking it all down for us. Thank you for giving us the insights. At least I'm sure now a lot of listeners have learned something new today and how better to manage and care for themselves, especially during either the cold, flu season, whatever season, Hamatan season. You know how better to take care of yourself. But for those who would like to get more, maybe one-on-one consultation, they want to get more insights, how can they reach out to you, your social media handle that they can reach out to you and ask further questions?
Okay, so the, the Lagoon Hospitals is we have Lagoon Hospitals on the website.
Right.
We have it on our Instagram, on LinkedIn. You can always get in touch with us on those social media handles or through those
Right.
avenue, and then
Okay.
we'll be happy to attend to you.
Okay, Lagos. That is how we draw a curtain today on Smooth Health. It's been an interesting and insightful one, especially as we're in this season. So it was more than important for us to get all the insights. Once again, thank you so much for the insights, Dr. Adegboyega Alao. And in case you're wondering, yes, he is a consultant family physician at Iwosan Lagoon Hospital. So you want to get insight from him? Hey, you know where to find him. But there's so much lined up for you, Lagos. So if I were you, I'll stay glued to my radio and get them in good time. But it's always important to take care of your health. And if things aren't as they seem, please, by all means, visit your doctor. Every Thursday. Thank you so much for your time. I truly
All right.
appreciate it.
Thank you.
Have a
Thank
pleasant
you. I'm
evening.
happy to share my knowledge.
All right.
Thank you.